Hey guys, this is Dr. Nikunj and you are watching Dr. Class. So this is the second session to understand general terminology used for understanding anatomy. So let's start without wasting our time. So we will discuss here about terminologies related with the joints, with the muscles and with the vessels present in body. So our first start is with the movement. Terminologies related with the movements. The first one is the gliding movement. Let us understand what do we mean by gliding movement. So the gliding movement is movement occur in between the flat surfaces. So what kind of movement you can assume? In between the flat surfaces there is anterior posterior, means forward backward movement should be happen, and the sideways movement should be happen. So here there is the anterior posterior, here there is anterior posterior, or you can say forward backward movement, and this sideways movement has to be performed. But without, the very important thing is what? In the gliding movement, the most vital point is that this movement is done without significant change in the angle of articulation, or in other words, without the significant change in the angle of joint. Let me introduce an example. Suppose if I move the palm like this, what happened here? These are the carpal and they are joint like this. Okay, so from upside you can say the articulation is in a side to side on a 0-degree angle, and on the upper surface this articulation is in a 180-degree angle. But when I turn the palm like this, what happened here? Right, the carpal are still like this. Okay, so still, yes, the direction is changed, but angle is not changed in this movement. So this kind of movements are basically known as the gliding movement. Right. So let's see the second type of movement, and that is the angular movement. So angular movements are those movements in which the angle of articulation, angle of joint is changed, and one of them is the flexion. Let us understand the flexion first, right? And related with it, flexion, the opposite term is extension. So the flexion is what? When we move our body in that direction, or we move the joint in that direction by which the angle of articulation, angle of joint get decreased, okay, right, which result in the angle of joint has to decrease. That movement are known as the flexion. But in that movement where we move and joint angle is get extended, or you can say increase, that kind of movement is known as the extension. Let me introduce here. Right, suppose the arm is like this, okay, and if I bend the elbow, what happened here? That the humerus, the angle between the humerus and the ulna, or in other words, the angle of the elbow joint get reduced, and that kind of movement are basically known as the flexion. So what we conclude here, that the flexion is the movement where what happened? The angle of articulation is significantly decreased. And the extension is the movement in which the angle of articulation is significantly increased. So this is the funda of the flexion and extension, right? So let us see the third terminology, and that is abduction. And the related with the abduction is the adduction. Okay, we already learned the midline and the median plane. Okay, so movement which result the limb or a digit or any part of body away from the midline or away from the median plane, that kind of movement is known as the abduction. So in this movement, what happened here, right, if I raise my arm, what happened here, that arm is now going far from, or upper limb going far from from the midline, so that kind of movement is known as the abduction. When I keep the arm, suppose this is the normal anatomical position, right? And from the normal anatomical position, if I raise the hand, what happen here? The abduction is occur. Okay, and if I take the hand towards the midline, that kind of movement is known as the adduction. So what we learn here, that the abduction is the movement. Abduction is the movement in which what happen, that the distance of the part and the midline is increases, right? And the adduction is the movement in which the distance of part and the midline is decreasing. Okay, so the abduction is far movement and adduction is the inward or toward movement. Let us say next terminology, right? So the another term is like the medial rotation. So opposite to this is the lateral rotation. So what is the medial rotation? When we rotate something or body part towards midline, when we rotate our body parts toward midline, that kind of movement is known as the medial rotation. Like this, suppose this is the arm. If we turn this like this, okay, if I turn my shoulder like this, what happened? I don't know that you can see or not. Okay, if I turn the arm like this, what happened? This is the rotation, rotatory movement towards the midline. So that kind of movement is known as the medial rotation, where the movements are opposite to the midline or far from rotation, far from the midline is known as the lateral rotation. The seventh one is circumduction. So circumduction is basically the involved movement or a combined movement of extension, flexion, so first one is extension, then abduction, flexion, and last but not the least, adduction. Okay, so basically circumduction is the movement found in a thumb. Okay, so this is the normal position of thumb, right? So when first of all we have to do extension, so this is the extension of thumb, right, where the digits, okay, the angle between these two digits or a phalanx is increased out, so this is the extension. After what I do abduction, then the flexion and the adduction, right? So what happened here, the combined movement is result like this. Okay, so this rotation of thumb is known as a circumduction, where we are performing four movements together like extension, abduction, flexion and extension or abduction, right? So basically, let me repeat. So the circumduction is the movement in which you are performing the extension, abduction, flexion and adduction. Okay, right? So circumduction is the combined movement of these four. Are you getting me what I mean? Right. So let us look on a PPT now. Okay. So let's see the terms used in the case of the movement, right? So this is the gliding movement. We already learned about the gliding movement, that the movement between the flat surfaces in forward backward direction as well as in the sideward direction. Another one is the angular movement. Then the rotation, we already learned about this, the medial rotation as well as lateral rotation, right? And the special movement like circumduction. So special movement circumduction is the combination or a sum total of four movements of angular movements. Right, so this is the example of the gliding movement. When you turn palm on this or this direction, whatever direction you turn, right, what happened here? There is the change in the angle of the wrist. Okay, there is change in the angle of wrist. Okay, like this. But there is no change in between the articulation of a bone, okay, or angle of bone, right? So let us look next. Okay, let's see the angular movement. So this one is a flexion. First one is a flexion. So flexion is the movement which result, okay, flexion is the movement which result in the decreasing in the angle, decreasing in angle of joint or articulation, okay, and the surface which is responsible for the flexion, that kind of surface are known as the flexor surface. Very important one. This surface is known as the flexor surface of upper limb. The another term is extension. So extension is the movement in which what happened, there is increase in angle of joint, okay, right? So when we done the movement like this, but in the case of back extension, the terms are changed. So when we turn backward, okay, when we flex backward, what happened here, when we turn backward, there is angle from the vertical direction, angle from ventral direction is being increased. So that kind of movement is known as the extension of back. Clear? But in the case of arm or elbow joint, the extension is limited at the 180 degree. So the another term is abduction. So abduction is the far movement of a limb from the midline. The adduction is the far towards movement to the midline. Circumduction is the combination of these four movements together. The medial rotation is the rotation toward midline. The lateral rotation is the rotation far from the midline. The supination, yes, it is important. The term supination is means that during let us see the supination and the pronation is used in the case of forearm. When you stand like this, okay, so this is the position of supination, right? And when we turn the arm like this, when we turn the forearm like this position is known as the pronation. These are some figures you have to look. So the movement, okay, bending movement of the elbow joint in this direction will result to the decrease of angle, that is known as flexion, and the movement far from, or you can say movement away from the mid axis, right, which lead to the increase in angle, right, the movement lead the increase in angle, that is known as extension. Right, so the terms flexion and extension can be changed. In the case of shoulder, what happened, right, this is the flexion of shoulder like this, okay, right. So during flexion of shoulder, what you have to do, you have to keep your arm upward, right, this is the extension, and this one is the backward is the hyperextension. When we take a lower limb forward without bending the knee or without flexion of knee, that kind of movement is known as the flexion of hip, okay. And without bending of knee, if we take thigh backward, that movement is known as the extension of hip or extension of the hip joint, right. This is the extension, this one is the extension, and this one is the flexion of the knee joint. So basically the surface which result into the flexion is known as the flexor surface, and the surface which result into extension is known as the extensor surface. The extensor and flexor are different as per the body part. So movement far from the midline, suppose this is the midline, so movement far from the midline is known as abduction, and movement toward the midline is known as the adduction. Let's look next. Okay, so medial and lateral rotation is what? We are learning the medial and lateral rotation in the case of shoulder, and this is the medial and lateral rotation in the case of hip. So without the flexion of knee, if we turn the feet inward direction, that movement is known as the medial rotation of the hip or medial rotation of thigh. And without flexing the knee, if we turn the feet outward direction, that movement is known as the lateral rotation of thigh. So these are the medial and lateral rotation according to the thigh, okay. So let's look next. So the another one is the opposition of thumb. So opposition of thumb is like you touch the thumb with the any finger of the palm, that kind of movement is known as the opposition of thumb, right. The next one is the circumduction of thumb. We already learned about the circumduction of thumb, right. This is the movement like which what we done, right. Circumduction is the movement which is the combination of extension, abduction, flexion and adduction, right. So that kind of movement is known as the circumduction, the dorsiflexion and the plantar flexion. These two terminologies are applied for the turn our feet upward. This is the palm, I know, but if you take the feet, okay, so if we turn feet like this, so that movement is known as a dorsiflexion, right? And if we move the feet on an opposite direction, that kind of movement are known as the plantar flexion. The inversion and the eversion is what movement? Okay, if we turn feet on the outward direction, that is known as eversion, and if we turn feet in an inward direction is known as the inversion. Right, let's look the protraction and the retraction. If we protrude out the jaw on a forward direction, if we move the mandible in anterior forward direction, that kind of movement is known as the protraction. Pull mandible inside, that kind of movement is known as the retraction. So this is the movement of thumb opposition. Okay, so when you touch the thumb with any of four fingers, that is known as the thumb opposition. So if we move the feet upward direction or towards tibia, that kind of movement is known as the dorsiflexion. First of all, understand that in feet the upper surface is known as the dorsal surface, and the lower surface, basically, which is the ventral surface, is known as the plantar surface. Okay, so this surface is the plantar surface. Okay, this one is plantar surface, where this one is the dorsal surface. Okay, so movement of dorsal surface towards the tibia is known as the dorsiflexion, and movement far from the tibia, right, is known as the plantar flexion. Clear? So this is the eversion and inversion. Okay, movement outward, feet movement of feet outward is known as the inversion, and movement of feet inward, the movement of feet inward is known as inversion, and the movement of feet outward is known as the eversion movement. So this is the protraction when we pull the mandible, when we push mandible outward direction, and when we pull mandible inside or inward direction, that known as the retraction. Let us look the terminology related with the back. So we already discussed about this, and the terms are like the back extension, back flexion, lateral flexion, and the lateral rotation. Let's see one by one. Okay, when we pull backward, when we pull body backward, that kind of movement is known as the extension, and bending forward, bending backward is known as back extension. Okay, so bending backward is known as the extension, and bending forward is basically known as the flexion. Bending sidewise is known as basically lateral flexion, and the rotation sidewise is known as the lateral rotation of back. So bending forward basically known as the flexion, and bending backward is basically known as the extension. Let us see the terminology related with the muscles. The first one is origin, and the second one is the insertion first. Okay, so origin and insertion of muscle is what? The muscle is fixed at a one end, and the second end is movable. So the fixed end of muscle is known as the origin. So what origin is? Right, so origin is the fixed end. Origin is the fixed end of the muscle, and the insertion is movable end, or a free end of the muscle, movable end of muscle. Right, so this is all about the origin and insertion. Okay, right, let me introduce this. Okay, if you perform the flexion of arm, what happened? Flexion of elbow, what happened? You can feel here that this is the end where you cannot find any kind of movement. But if you look and deep palpate this tendon, what happened? When you move the arm, this tendon and the muscle goes upward. Right, so that is what this end is, the origin of muscle, and this end is the insertion of the muscle. Now let's see the belly tendon. aponeurosis and ligament. Okay, so these are the general terminologies. So let's look the structure of muscle, right? So if this is the bone, okay, and if we take an example of the bicep brachii, what happened here? Bicep brachii is the muscle originate from the two sides. One origin is from here and the second origin is from here, right? So both the strias, both the fibers, right, comes like this. The upper end, the upper part of origin is this cylinder or fibrous origin is little bit thicker, right, and that is known as tendon. So after origin, this part, this muscle fibers are become a fleshy. This muscle fiber is become fleshy, and this fleshy muscle fibers make the real part of a muscle or a main part of the muscle like this. Okay. Clear? So at the time of origin, what happened? The muscle fibers are originate in very dense amount, right, and it will become a thicker band, and that band is known as the tendon. Afterward, this muscle will become a fleshy, and that fleshy part is basically known as, this kind of fleshy part is known as the belly of muscle. So belly of muscle is the main portion of muscle where the tendon is situated at the origin side as well as at the insertion side in the form of the very thick fibrous band. So in some cases we are finding, so this one is what? This is the origin, which is fixed end, and this is the insertion. The common thing is at the insertion and origin, the part is the thicker one, and that is known as, the thick band is known as the tendon. Basically origin is a fixed end and the insertion is the movable end, or you can say a free end. So yeah, just understand about the origin, insertion, belly, tendon. Now let's see about the aponeurosis. What do I mean by aponeurosis? When a muscle fiber, when tendon goes flattened, okay, so basically a flattened tendon is known as the aponeurosis. After aponeurosis, let's look on a ligament. So ligaments are basically also a thick band of fibers which are in between the articular surface of the joint, and it will make joint strengthen. Okay, so let's look here that this is the muscles origin and insertion. So here there is three muscles are there. These are the muscles of arm, right? This one is the bicep brachii. Okay, so bicep brachii, as we learn that it is originate from the two side, and at the origin side the muscle fibers are very thick and dense, that is known as a tendon. So these are the tendons. This is the fleshy part, right, and this fleshy part is basically known as the belly. Whereas at the site of insertion, it is now also again become a tendon. Okay, but here what you find that the tendon is become flattened. Okay, and this flattened tendon, this flat tendon is known as the aponeurosis. Here also same, right? So this is the subscapularis. Okay, this one is the subscapularis, right? So subscapularis is originated from this surface, right, and it is inserted here. The coracobrachialis is another muscle of arm, right, which is originated from this place and insert here, right, and this is the brachialis. So this is the belly of brachialis. Clear, right? So let's look again next part. Sure. So this is the explanation, right? So origin is what? Origin is the bony attachment, but a stationary end of the muscle. The immovable, stable end of muscle is known as origin. The thicker middle region of a muscle between the origin and insertion, a fleshy part of muscle, is basically known as the belly, and the bony attachment, but the mobile end is known as the insertion. So majority of case we find that the origin is stationary where the insertion is mobile, but in some cases we can find that the origin is mobile and the insertion is stationary. So this origin and the insertion funda is not that much rock solid, clear, right? So what we find, this is the tendon, okay, this one is the tendon, and this tendon is the palmaris longus tendon, okay, this is the palmaris longus tendon. Okay, what we find here, that this palmaris longus tendon goes inward and become flattened. Okay, so these are the ligaments. Okay, these five are metacarpal ligament, right? But between that, what you find, the transverse stria. Okay, so these transverse stria are basically known as the palmar aponeurosis. Let's learn about some terminologies related with the blood vessel, right? So the blood vessels are stored in the form of arteries, okay, right? The biggest artery is aorta, and arteries are those vessels the blood away from heart. Okay, those vessels which is responsible for the movement of blood far from the heart, whether it consists the deoxygenated or oxygenated blood, that kind of vessels are known as the arteries. But basically arteries compose the oxygenated blood, but there are some exceptions, right? And there are two exceptions. One is the pulmonary artery and second one is umbilical artery. In form, you will only find the pulmonary artery, but during the embryonic life you can also found the umbilical artery as well, right? So this is the big artery. Basically big artery turn into the small artery during the supply. During the supply, these big arteries turn over the small arteries. Small arteries again turn over the small artery, right? So this is the artery, okay, and the smaller arteries are basically known as the arteriole. But at the level of tissue, this arteriole will become further divide. This arteriole further divide in so many of branches, and that is known as the capillary. So this is the arterial end. This is the arterial end of artery, right? Here should be the muscles, right? This is the muscle, or you can say any tissue. Okay, so at the time when artery supply blood towards the muscle, what happened now? Artery supply the blood toward the arteriole and the capillary. Capillaries are much towards or near to the muscles or a tissue, and tissue has more partial pressure of carbon dioxide and less pressure of the oxygen. Okay, so by the diffusion, what happened? The oxygen present in artery goes inside the muscle, and carbon dioxide present in the muscle or a tissue goes inside the artery. After all, this will result into the deoxygenation of the vessel or deoxygenation of blood, and afterward this capillary is run with the deoxygenated blood, and now the vessel would run deoxygenated blood. This kind of capillaries are known as the venule capillary. Venule capillaries, right? And afterward, these capillaries make sure to merge with each other and form the venules. And afterward, the small venules from each part of body join together and form a big vessel which is known as the vein. And the biggest vessels, the biggest veins of our body is inferior and superior vena cava, right? So this is all idea and the terminologies related with the blood supply of a body. Learn the terms used for the describing vessel, and we learn about the arteries, veins and capillary here, right? What do you mean by anastomosis? So anastomosis is nothing but the communication or a joint between the blood vessel. Okay, so let's look here. Here what we find, the big artery is divided in the smaller arteries, right? And the smallest unit of artery is known as the arteriole. Arteriole further break down and divide into the arterial capillaries. Okay, arterial capillaries, right? This capillary will give oxygen toward tissue and take carbon dioxide from them and become the deoxygenated, right? And now it's carry the deoxygenated blood, which is known as the venule capillary. Venule capillary merge with each other and take a drain blood into the big vessel, which is known as a venule, and now venule also drain blood into more biggest vessel, and that is known as the. Okay guys, so this was the brief review of the terminology used to understand anatomy. In the next session, we will discuss about the terminologies related with the clinical conditions in the body.